Hello, my name is Dr. Mad. How are you? Wonderful. Well, I'm so sorry you're not feeling that well. Okay. Well, let me go ahead and check you in my system. I want to make sure that I'm in the right room, first of all. Can you please verify your first and last name and your date of birth? Okay. Okay, perfect. So I'm going to ask you a few questions. I do have your file here. I want to make sure that I have all your information and medical history. Any surgeries in the last 2 years? Okay. Appendectomy. And at which hospital was that? Okay. Any complications? No. Good. And do you still suffer from hypertension? Yes? Okay. I'm gonna go ahead and pull your chart from last night to make sure that I have all your vital signs. Oh, I see it was a little bit abnormal, your blood pressure, so I'm gonna go ahead and make sure that I recheck it. Okay. And do you still suffer from hypothyroidism? No? Alright, I'm gonna go ahead and scratch that off. Okay. Alright, what about allergies? Okay. So let's see. That's good. Alright, and for your pain, do you still have pain right now? Okay, see that the nurse gave you Tylenol? Okay. And your pain level was about a 5 when she gave you the Tylenol. Now, how would you rate your pain right now? Okay, so it seems to me that your medication did work a little bit since your pain level is about a 2, which is acceptable, correct? Okay. Now, do you feel that you would like some more pain medication? You can go ahead and order ibuprofen. Okay, yeah, definitely I can do that for you. All right, perfect. Okay, so I'm gonna go ahead and put gloves on. And I will do a general inspection after I take your vital signs. Okay, so I have my blood pressure cuff right here. And is it okay if I use this arm? Good. Okay, so I'm gonna go ahead and do this. Okay. Just make sure that you'll uncross your legs for me, please. Thank you. I'm going to put this on your chest here. Okay, let's go ahead and put the stethoscope on. Okay. Good. Okay, good. One more squeeze. Okay, so your blood pressure is a little bit elevated, but maybe because of the pain that you've been experiencing, sometimes that could contribute to the pain. Okay. And have you been drinking anything too hot or too cold in the last 30 minutes? No? Okay, so what I'm going to do is I'll put this underneath your tongue and it's going to take your temperature in Fahrenheit. All right, go ahead and open your mouth for me, please. Okay, just keep it like that. Good. Okay. 98.6. That's perfect temperature in Fahrenheit, so that's really good. And let's go ahead and measure your oxygenation and your heart rate. I'll put this on your index finger if that's okay. Okay, go ahead and take a deep breath in for me. And breathe out. One more time, take a deep breath in. And breathe out. Okay. Your oxygenation is 95 percentile on room air, which is really good. But your heart rate is also a little bit elevated. And I'm gonna have to keep an eye on that. Okay. Okay. Okay, so I'm gonna go ahead and do a general inspection of your full body. And I'm going to first palpate and take a look at your head, move down to the face, neck, chest, abdomen, legs, and then feet, okay? All right. So go ahead and relax for me as I'm gonna go ahead and palpate your head here. That's good. And on this side as well. Okay. Head is symmetric. I'm not feeling any kind of lumps. No tenderness. No pain. That's good. And I'm gonna go ahead and just palpate your face. Let me know if you feel any kind of pain. Pain here. Okay. Here. And I'm gonna go ahead and check your neck as well. Any pain as I'm moving you like this, gently? No? Good. Okay, I'm gonna go ahead and do a little bit of tapping. Let me know if you feel any kind of pain. Good. Okay, so I'm gonna go ahead and move down your body. Any pain as I'm palpating your chest here? Okay, that's good. Any pain here? Okay. So I'm palpating your arms now, and I'm not feeling anything abnormal, which is really good. I'm gonna go ahead and palpate your chest area. I'm feeling for any asymmetry. Okay. Good. And I'm going to check your other arm. Is it okay if I lean over? Thank you. Okay. Any pain here? Okay, what about here? Okay. That's good. So I'm going to go ahead and auscultate. So I'm going to use my stethoscope to listen to your heart, your lungs, and your abdomen. Okay. Is it okay if I put my stethoscope underneath the blanket? Thank you. Okay, so go ahead and breathe normal for me. Right now I'm just listening to your heart, and I'm trying to see if I can hear any extra sounds. Okay. S1 and S2 are heard. No S3, no S4, which is great. Okay, and I'm going to listen to your lungs as well. So now I need you to take a deep breath in and exhale. Good. And again, take a deep breath in and exhale. Good. And one more time, take a deep breath in and exhale. And on the sides, take a deep breath in and exhale. I'm going to go ahead and listen to the other side as well. Just going to lean over. Okay, good. All right, let's go ahead and check your abdomen now. So what I'll do first is I'll listen and then I will palpate, okay? Is it okay if I put my stethoscope again underneath the blanket? Okay. All right, so go ahead and relax. I'm just trying to listen for your activity here. Okay, good. So very normal bowel sounds, which is good. Okay, good. Excellent. Okay. Okay, so I'm gonna go ahead and palpate. Any pain as I'm doing this? Okay, good. Okay, so I'm not feeling any enlargements, no masses. Liver seems to be normal size, which is very good. And everything feels very good and normal. I'm gonna go ahead and check your legs. Let me know if you feel any kind of pain as I'm palpating. Any pain as I'm doing this? No? Okay. Any pain here? Good. Okay. Can you wiggle your toes for me, please? Good. And now push with your heels. Excellent. And push with your pads first. Good. Excellent. So very good motor coordination there. And I'm going to go ahead and palpate this leg as well, your left leg. Any pain as I'm doing this? Any pain here? Okay, I see. So what it could mean is that maybe you were spending too much time in bed, and I'm gonna need you to walk a little bit more, okay? Make sure that you're using your body in the proper way, that you're squeezing your muscles, and you keep your core muscles engaged throughout your activities. Good. Okay, I'm gonna go ahead and percuss your abdomen. Let me know if you feel any kind of pain as I'm doing this. Good. 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 Okay, perfect. Is it okay if I sit down next to you? Thank you. Okay. Just gonna go ahead and examine your eyes now. So what I'm gonna do is I will flash a light and make sure that I'm checking both pupils. So go ahead and look straight at my nose. Good. Keep on looking straight at my nose. Good. Okay, now I'm going to gently press with my palm on your cheek. Okay, so go ahead and look right here for me. Look right here. Good. Keep on looking there. Good. 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 Perfect. So we'll do the same thing on the other side. I'm going to have you look this way. Good. Perfect. Okay, so I'm checking pupils for reaction and dilation. Your pupils are round and reactive to light, which is wonderful. So what I'm going to do is I'll have you follow the light now. So go ahead and look at the light without moving your head. Good. Perfect. You're doing great. And now I'm going to go ahead and shine a light in your eyes. Bring it a little bit closer. And I will have you follow the light with your eyes only. Don't move your head. Same thing. Good. Good. You're doing great. Okay, and now go ahead and look at my fingers right here. Good. And now look at the light. Good. All right, let's do the same thing on the other side. Look at my fingers right here. Now look at the light. Good. I'll bring my fingers a little bit closer and I'll wiggle them in your field of vision. And after that, I'm going to ask you to shift your vision towards the light again, okay? Look at my fingers. And now look at the light. Good. Okay. I'll do the same thing on the other side again. Look at my fingers. And now look at the light. Good. Okay, let's go ahead and check your peripheral vision. So I'm going to ask you to tell me which fingers I'm moving, my right or my left, okay? Good. 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 Perfect. Good. 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 Wonderful. Okay, let's go ahead and check your vision with the Snellen chart. And can you please cover one eye? Very good. Go ahead and tell me what color you see right here. Red. And what color do you see here? Green. Okay. Can you please tell me what number this is? 4. Good. And what about this one? 7. Excellent. Can you please tell me which circle is bigger, 4 or 5? Definitely 5. Very good. All right, so let's go ahead and check now if you can see the letters. So I'm going to have you keep the same eye covered. And can you please tell me what letter this is? D. Good. What about this one right here? O. Good. Can you read the last row starting with the first letter to your left? Good. L, D, F, P, H. Okay, so that's very good. You can go ahead and switch eyes now. Good. Can you please tell me what color this is? Good. And what color is this now? Green. Very good. Is this the same amount of red that you saw with your other eye? It is. Good. All right. Let's go ahead and see if you can see your circles. Can you please tell me what number this is? 9. And what number do you see here? 2. Okay. And which circle is smaller? 2 or 3? Definitely 2. Okay, that's good. And now, can you please tell me if you see this last row? Okay. Do you think you can read, starting with the last letter to your right? Okay. Good. H, P, F, T, L. Okay, excellent. So that's very good. Let's go ahead and check your colors. And can you please tell me what color you see here? Red. Good. And what color do you see here? This one right here. Green. All right. And what about this color? What color is this? Yellow. And what about this one? What color is this? This one right here. Blue. Perfect. Okay, so that was very good. Let's go ahead and check your ears next. Have you noticed any abnormal discharge coming from your ear canal? No. Okay, so what I'm going to do first is I will palpate your outside part and make sure that I'm not feeling any lumps and that there's no pain there, okay? So go ahead and relax for me and tell me if you feel any kind of pain as I'm doing this. No? Okay. So I'm going to go ahead and check your hearing now. From my examination, what I noticed is that you can hear properly, but I'm going to perform a whisper test. So I'm going to whisper some words in your ears. They're going to be very, very minimal volume. And I'm going to need you to repeat those words back to me, okay? Great. 1954. Good. 1855. Holy Land. Monkey Bar. Nitro. Cold to brew. Remote control. Sleep. Good. So it seems like everything is in order. I'm going to go ahead and check your tympanic membrane now. Is that okay? Okay, so I'm going to ask you to look that way for me, please. Good. So go ahead and breathe normal for me, please. Okay, tympanic membrane is pearl gray. I'm not noticing any abnormal discharge, no signs of infection. And the ear canal looks very clean. That's good. Okay, let's go ahead and check your other ear now. So go ahead and look the other way. Good. And your left ear looks good too. Tympanic membrane is also progress and no signs of infection. I'm not seeing any fluid buildup behind. That's good. Okay, no signs of any fluid. Okay, perfect. So I'm gonna have you relax now. It looks like everything is very normal. That's good. Let's go ahead and check your hearing with the tuning fork. So what I'm going to do is I will put it in two different positions, behind your ear and in front of your ear. So I'm going to need you to tell me which position here is louder, position number 1 or position number 2, okay? So this is position number 1, and this is position number 2. Okay, very good. Let's go ahead and check your other ear now. So this is position number 1, and this is position number 2. Definitely number 2. That's good. Okay. All right. So what I'm going to do is I will just gently clean your ears a little bit. Is that okay? Okay. I'm going to first spray with some cleaning solution. Good. And just going to go ahead and just clean your tragus, the outside part. That's good. Okay, let's go ahead and check your other ear now. Good. Alright, I'm going to go ahead and check your nose now. Can you please look up for me? Good. Any pain? Good. What about here? Okay. Good. And I'm going to go ahead and close one ear. Can you breathe in, breathe out through your nose? Good, and the same thing on the other side. Can you breathe in, breathe out through your nose? Very good. Okay, let's go ahead and check your smell. Oops. Okay, go ahead and take a deep breath in and breathe out. Good. And again, take a deep breath in and breathe out. And can you tell me what that smells like? Lavender. All right, I love that smell. It's very refreshing and calming at the same time. Okay, let's go ahead and do the same thing again. Take a deep breath in and breathe out. Take a deep breath in through your nose and breathe out. Good. So what does that smell like? Okay, so that is called stress away. It definitely takes any pain and any stress away, so that's good. All right, and I noticed that you have kind of a stuffy nose. Now, that did not enable you from smelling, so that's really good, but I'm just gonna go ahead and insert some nasal drops. Is that okay? Okay, so go ahead and a lot left in it. I'm going to ask you to look up for me, and I'm going to put one drop, okay? Okay, go ahead and look up. Good. And I'm going to insert one drop. And 2, 3, and 4. Okay, go ahead and breathe in through your nose. Good. And out through your mouth. And again, breathe in through your nose and out through your mouth. So it's going to take a few minutes maybe for the effect to be seen. All right, I'm going to go ahead and check your taste now. So I'm going to put 1 drop on your tongue, and I'm going to need you to tell me what that tastes like. But first, let's go ahead and make sure that there's no obstruction. And even though you've been able to talk to me very normal, so that means that your tongue is properly positioned. You can use it very good without any problem. So go ahead and stick your tongue out for me. Good. Okay. No abnormalities noted there. And can you please swallow 3 times? 1, 2, 3. Excellent. And can you please stick your tongue out? Good. And move it side to side. And up and down. Good. And can you please give me a big smile? And now frown. And puff your cheeks. Keep them puffed for me, please. Don't let me unpuff them. Excellent. And can you please try to look this way? I'm going to go ahead and just gently press on your face here. Good. And now try to look that way. Good. Okay. Okay, very good. So let's go ahead and check your taste. I'm going to put 1 drop on your tongue. Okay, all of our taste samples have an oily base, so it's not going to feel uncomfortable at all. Can you please stick your tongue out for me? And 1 drop. Good. What does that taste like? It tastes like rose petals. Okay, very good. That is exactly what it is. And I'm gonna go ahead and check your facial sensation. Have you noticed anything abnormal? No? All right, so 1 is going to feel dull, 1 is going to feel sharp. Let me go ahead and show you what I mean by that. Okay, so I'm going to touch you with a sharp object. And right here on your chest. That's what it's going to feel like. And I'm going to touch you with your soft object. So go ahead and say if it's sharp or soft. Okay. Sharp. Soft. Sharp. 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 Soft. Good. Sharp. Okay. And now I'm going to go ahead and move down your body, okay? So you're going to feel sharp or dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Okay, good. I believe that is all. Everything looks very good and healthy. I was able to do the full body examination and I believe you are in pretty good shape, but I really want to address that pain that you've been experiencing. So what I'm going to do is I will prescribe a little bit extra pain relief medication. So you taking Tylenol, and I'm going to go ahead and prescribe some ibuprofen. Now, if you have any questions for me, don't hesitate to call. to press the call button, and I'll make sure that I'll answer all of your questions. Does that sound okay? Good. Thank you again for allowing me to examine you, and I will see you back soon.